Concussions have become a big part of the NFL over the past few years, particularly this year. Today I'm going to go over what a concussion is, how it happens, as well as how a player can get back to playing after sustaining a concussion in an NFL game. So what is a concussion? A concussion is considered a traumatic brain injury. This is also used interchangeably with a mild TBI or traumatic brain injury. Basic idea of a concussion is when one experiences a concussion, it leads to a disruption of normal brain function, impacting the cognitive processes, emotions, and memory in that individual. So how does a concussion happen? So the typical mechanism of injury is caused by either a directly or indirectly impact, typically resulting from a direct blow from the head. So the brain is made out of soft tissue and it is surrounded by the hard skull/bone. Surrounding the soft tissue of the brain is a little bit of space where the brain can manage and move, especially if there is an impact. And within that space, there is blood and cerebrospinal fluid. That's really important when you do think about a concussion. The typical mechanism of injury is when that skull is jolted too fast or impacted by something, that brain shifts and hits against the skull. Now, with diagnosing someone with a concussion, it is important to have a history of a direct blow to the head. Now, there's also a clinical presentation or signs and symptoms that help us diagnose a concussion. And when it comes to concussion, it's not black or white when it comes to symptoms. It varies greatly with signs and symptoms, but can appear either instantly or it can appear even hours a day after the blow to the head happens. There are four main classifications of a concussion symptoms. You have your physical symptoms. These include headaches, dizziness, vision changes, and balance deficits. You have mental processing, which is considered not thinking clearly, feeling slowed down. You have mood, which one can be short-tempered, sad, or emotional. And then you do have sleep, where one experiences insomnia or excessive sleep. After discussing some general information about a concussion, we're going to turn to the NFL now. Discuss the in-game NFL protocol for concussions, as well as go over what a player must do if they were diagnosed with a concussion, and what they have to do to get back into playing an NFL game. Discuss the in-game NFL protocol for concussions, as well as if a player were to be diagnosed with a concussion, what they must present or how they must progress in order to get back to playing in the NFL games. So the NFL had published a brochure that is the concussion game day checklist. This is just going to go over what the player medical staff would do if they suspected a concussion during the game. This is a very thorough checklist of items performed and observed to protect their NFL players. So what must happen is that player receives impact to the head, and then either two of these must also happen. So either the player exhibits or reports symptoms or signs suggestive of a concussion or a stinger. Once again, the symptoms or signs include those physical changes like headache, dizziness, balance, vision changes, mental changes, maybe slowing down, not thinking clearly, or the ATC, which is your athletic trainer, booth ATC, team physician, an NFL official, coach, teammate, or UNC, which is your unaffiliated neurotrauma consultant, initiates the protocol. So if either two of these three happen, then the player is immediately removed to the sideline or stabilized on the field as needed. So what goes on at the sideline? So they remove the helmet, the team physician or the neurotrauma consultant perform a sideline survey. Here they review the history of the event, the signs and symptoms that the player is presenting, as well as they go over the Maddox questions. These are 8 standardized memory assessment questions, and they're just for general orientation and are specifically sports related. So whoever is initiating this exam of the player, they're going to also do a focused neurological exam. So when it comes to hitting their head, they're going to focus on a lot of different areas of the body, because a lot of different things can be affected because the brain controls basically everything that we can do. So we're gonna look at that cervical spine exam, so including the range of motion of what our head can do. They'll be evaluating the speech of the player. They will be observing the gait. As we talked about, balance can be a big deficit after sustaining a concussion. They're also going to be looking at the eye movements, as well as conduct a pupillary exam, focusing in and seeing how the eyes and the pupils react to light. It's all controlled by those cranial nerves, once again, can be impacted by concussion. If any of the elements are positive, inconclusive, or suspicious of concussion, the player is escorted then to the locker room. So an automatic no-go for going back into the game would be any signs of loss of consciousness. This includes a seizure and or fencing posture, which is that involuntary like posture when one arm is outstretched and the other is bent. which typically is shown after that high force blow to the head. Ataxia, which is a neurological sign characterized by a lack of muscle coordination that can affect the balance, gait, speech, and eye movement. Generalized confusion or amnesia, which is the total or partial loss of ability to recall events or learn new information. So if any elements are positive, inclusive, or suspicious of a concussion, the player is then escorted to the locker room. This is where they're going to complete the locker room exam. This, once again, is completed by your team physician, your UNC or ATC. They're going to complete the NFL SCAT, which is a sports concussion assessment tool. This is a more detailed evaluation as compared to the preseason baseline SCAT results that the player did take earlier on. As well as they're going to do another neurological exam there. So if the results are abnormal, there is no return to play. The player then would stay in that locker room, and then there will start a periodic evaluation by the medical team and followed up by a neurological exam. Once a player is diagnosed with a concussion, how do they return to full football participation activities? The NFL also published a protocol, which is a return to full participation protocol, that helps go through all the steps the player must take in order to return to full football activities. Throughout this protocol, the player is observed for signs and symptoms of a concussion at progressively more intense levels of physical activity. There's no specific timeline for when a player does come back from a concussion. However, there is a median time frame of about 9 days and a mean of 15 days. So we have phase 1, which is a symptoms limited activity. The player is prescribed rest, and this is going to try and avoid activities that are really going to cause those signs and symptoms to very exasperate any physical or cognitive tasks that might do that. So under athletic training and supervision of staff, they could start initiating of balance training with some light stretching, eventually progressing to that light aerobic exercise as tolerated. Then you do have phase 2, which is strictly aerobic exercise. This is under the oversight of the medical staff and should begin gradually with cardiovascular exercise as well as dynamic stretching and balance training. Next, we do have phase 3, which is a football-specific exercise. They're going to continue to do that cardiovascular exercise and be observed. They're also going to start to add mimicking sport-specific activities, and supervised strength training is introduced here. Here, specifically, the athlete is able to practice with the team in sport-specific exercise for 30 minutes or less, with ongoing and careful monitoring. Phase 4, we have club-based non-contact training drills. So they're going to continue to advance the activities that they were doing previously, as well as participate in non-contact football activities. These include like throwing, catching, running, and other position-specific activities. And importantly, the neurocognitive and balance testing should be completed no later than the end of phase 4. These results should be interpreted back to the baseline that they took in the preseason. And then finally, we do have phase 5, which is your full football activity and clearance. So in order to be completely cleared to play full football activity, the player must be examined by an independent neurological consultant. And as long as they believe that the concussion has resolved, they may participate in their club's next practice or game. I hope you guys enjoyed the video. I hope you learned a little bit about concussions and how they relate to football, as well as how the NFL has started to develop these protocols in order to keep their players safe, as well as how they can return back to playing in their games. Let me know if you have any questions down below, and thank you so much for watching.